So, Dr. Giroux, thank you so much for joining me here today. Dr. Giroux is a general adult psychiatrist who has a strong interest in community psychiatry. She assesses and treats people with various different mental disorders like depression, PTSD, schizophrenia, maladaptive coping mechanisms, and across the whole range, the diverse population. And she also helps people who are going through traumatic life transitions, whether that's loss, grief, and specifically how that trauma actually affects our bodies and our relationships and attachment styles. So thank you so much for joining me here today, Dr. Giroux.
Thank you for having me.
To speak to you, and obviously you are based in LA at UC Davis, is that correct?
UC Davis, yes, in Sacramento, yeah.
Wonderful.
Thank you so much, Francesca, for having me. It's a privilege to be part of that discussion with you today.
Great. So my first question to you is, as a psychiatrist, you have obviously many patients who are survivors of trauma, who are having to deal with their own trauma, and now they might have sort of improved a lot, and suddenly there's this global crisis that's hit everyone. Has that had a significant effect on your patients to sort of set them back in their treatment process, or how are they coping with what's going on in the world?
Yes, it's a very interesting question. A lot of the patients I work with have suffered developmental or complex trauma, which means that they have experienced repeated toxic stressors while growing up, which affected their brain development, their self-esteem, their general health, the way they relate to others, their ability to control impulses, and the development of safety and trust. The current state of uncertainty, unfortunately, can create a sense of threat and panic. And also the changes in their usual routines, all of that can become triggers of symptoms. Additionally, the social distancing can be especially hard for those who have suffered neglect in childhood. They might experience a reactivation of their abandonment feelings, for instance. This new stressor that we're all having right now can create all kinds of manifestations in all people, but also in the people I see here at the clinic, ranging from mood symptoms to insomnia, somatic manifestations, to difficulty concentrating, loss of appetite, addictive behaviors that get worse. Some people might relapse in gambling or smoking or drinking. Conversely, some people who were previously fragile before this crisis might actually feel better centered or quite functional, because this crisis brings up various existential issues and it can put things into perspective for them. It's like it's shaking them. It's like, oh my gosh, I better put my life together, or I want to help others. So they might feel solicited in that way and in a good way. Some who have been through our trauma recovery programs had already started working on self-care and healing, and that boosted their resilience, and now they see this as an opportunity to access it. Older people, which is also a big proportion of my panel, might often be perceived as vulnerable due to the past trauma, such as war, displacement, but they might in fact welcome this challenge with equanimity due to a phenomenon we call stress inoculation. So what is that? So it's a form of acquired immunity to stress, so to speak. For instance, experiencing stress during a lifetime, starting during formative years, might enhance our ability to cope with stress later. We can visualize an inverted U-shaped curve that would put the level of stress, for instance, on the x-axis in relation to the development of functional level on the y-axis. So too little or too much stress is not optimal. But some level of stress, like in the middle, with appropriate buffers to help a person process, is in fact leading to a more optimal ability to cope later in life. It's not that simple to predict the specific reactions in each patient, but it's important to stay alert, present, and be open to learning from them. I often say that my patients have been my best textbooks, and at the same time, for some people, the coronavirus has been the straw that broke the camel's back, and they were doing okay until the shelter in place cut them from their very much needed social functions and other activities.
Wow, that's That's so fascinating. And my natural reaction at the beginning was to really worry about the elderly population and how they're going to cope with isolation. And I know that isolation also reduces your immune system. But it's interesting to hear that how they're sort of almost inoculated and they're more maybe more resilient than maybe say young people and teenagers and children even. What would you say is going to be the sort of general overall psychological impact on the population as a whole? People who haven't necessarily, who aren't survivors of trauma, but and who are very high functioning people, but are they still going to have psychological issues maybe brought on through this pandemic?
Mm-hmm. That's a question I ask myself regularly. Everybody's life has been turned upside down to some degree, starting with school-age children. Sudden decrease in socialization can be difficult. Some don't adapt very well to remote learning because they're suddenly removed from their cues to structure and discipline that the classroom environment provided. Might also be tough for children to integrate a new representation within their parental figures who now also act as teachers. It can be confusing. Some parents have noticed that various regressive behaviors in their children, including temper tantrums and resistance to homeschooling, boundary testing rather, and clinginess. And teenagers, older kids or middle schoolers, who are deriving resilience from their extracurricular activities like sports or drama club, or were looking forward to the prom or other like rite of passage, so to speak, might feel devastated. They were looking forward to that and that competition or that event, and it won't happen this year. And older people in nursing homes who can no longer receive visitors might feel abandoned and struggle with grief, also as they see their friends around them dying. Activities we used to take for granted are now becoming complicated. Life has become algorithmic for certain workers, such as grocery store clerks or healthcare professionals who work on the front line and who must go through a step-by-step decontamination process after their shift, as soon as they get home to prevent the spread of disease in their household.
That's really fascinating to look at all of those different sort of cases. So as a sort of specialist in loss and grief, how are people coping with grief during the lockdown, or because of there might be various triggers for grief, but how are people experiencing that? What are the different stages of
Yes, and this is a question that's been asked to me by various people and also throughout my career. And what we find is that just like with any type of grief, there won't be any universal sequence of stages. I know Elizabeth Kubler-Ross had listed specific stages and a specific sequence. This was a helpful framework, but it doesn't apply to everyone. So depending on the meaning of the loss for each person, the emotional reaction will differ. So not everybody is going to go through a state of denial or anger, for instance, or negotiation. What I can say is I have witnessed in my clinical settings a broad range of responses, and in reaction to this pandemic, from trivializing the issue to feeling frustrated, to feeling sad or fearful, in shock, or numb, which can be a form of trauma reactivation. So people go into freezing mode. It's an adaptation. People try to cope, and that's the way the body found to cope with that overwhelming experience. So my answer and advice would be to not expect something specific, but expect anything. There's no right or wrong way, unless it's destructive to oneself or others, of course. But no right or wrong emotion, no right or wrong experience or thought. The important thing is to honor where we are and make room for the emotions, regardless of their type. For instance, I went myself from being numb because it was very overwhelming and to frankly becoming anxious and fearful. In March, I had Canadian relatives who were vacationing in Florida. And for a week or so, I became consumed with worry, trying to convince them to go back to Canada before a border closure. Thankfully, they made it fine. They're all okay. But at some point at the beginning of this global crisis, I sat down during one of my yoga practices and decided to pay attention to my fear. I befriended it, so to speak, without judging it, without telling it to go away. It was so enlightening. It's important to view our emotions as messages who can teach us so much about ourselves, about unresolved issues that we have. They're also there to tell us about an imbalance that's happening, and they're also the compass that can point, towards solutions. And Eckhart Tolle, who wrote The Power of Now, recently said that this pandemic is an opportunity to go deeper. Being in the moment can help consolidate our foundation of resilience.
So in fact, it's almost an opportunity to get to know ourselves better, to sort of befriend even the darker sides of ourselves, the negative emotions, and just be okay with that being part of the human experience rather than sort of distracting ourselves, which is what I've definitely done in the past. Whenever I had a negative emotion, I would just go to the gym, or I'd go see friends, or I'd just like try and bottle my emotions up. That's really fascinating. So
yeah, it can work for a while, but eventually we have to sit with the experience.
So obviously people are in confinement and lockdown, and they might not be living where they want to be, or they might be separated from some people, or potentially there might be some couples who are divorced who now had to relive together. I've actually seen that in Wuhan, the level of divorces has actually gone up significantly because of this experience. And I wonder if sort of after the lockdown we'll see a sort of shoot up, like a baby boom of people kind of coming back together. And I just wanted to know what the impact of this lockdown situation and the social or physical distancing is having on relationships. Is that going to have like a massive repercussion?
Yes, it's hard to predict, but I hear you, and I can anticipate that this crisis is just so destabilizing that in couples who are already fragile, for instance, that can create another imbalance and kind of be the straw that broke the camel's back. And we don't have a template for that. We don't have an instruction manual. Our parents didn't go through something like that, I think, at least mine. So their generation and even their parents' generation, they've been through other crises, but not something quite like that. So confinement might accentuate some of those tensions, might accentuate the solitude also already experienced by some people. Can also be a dream from introverts, of course, who crave for more silence. But ultimately, everyone needs a form of social interaction, and a harmonious, one. It's soon to tell how this new way of interacting later will affect relationships. So after the crisis, what is going to be what is the new normal going to be like? But it's a little bit worrisome to think that we might have to decrease physical contact because touch is so crucial to development. So I worry about those relationships that are going well and that are, that we expect to take place a little bit more than the divorce rate, although that will be another issue for sure. And that can have so many repercussions in the younger generations as well. So that's very sad. But the touch is important. It gives a feedback to our nervous system. And it helps with the development of the self. So it's kind of telling the baby's body where his or her body starts and where it ends and where the rest of the world starts, basically. It helps the baby to grow. It helps children to grow and develop. And in extreme situations such as touch deprivation, like in orphanages, some children have failure to thrive, and which is a growth delay, even though there's appropriate food intake. Yeah. So it affects, the emotional well-being is all connected with the physical growth and well-being. And later throughout life, hugging is essential for emotional well-being and good for the health. But in couples where things were not going so great, then it can be like very difficult to navigate that. And maybe people are confronted with the, the disintegration of the marriage now that they need that so much, but this is so tense. But the touch is important, and most of us are deprived from that right now, but it's important because it reminds us that we exist as human beings. We exist for someone else. So that would be my
we're not robots. We can't just sort of even though we're obviously having a social interaction right now, a virtual one, we can't just replace all of our physical social needs with like a virtual one. And so that touch is like hugging. So what are the daily challenges of people who have to do shelter in place, and what can they do to sort of manage their stress?
Mm-hmm. Yeah, so that's something that really interests me, because my approach to care is really emphasizing lifestyle hygiene. So when there's stress, we have to really find our best coping mechanisms and use them. The way life is structured now is different. So people were asked to shift gears very rapidly. With school closures, and I can attest to that, integrating remote learning while attending to professional duties from home can seem like an insurmountable task for parents who can ask their older parents to assist, right? We have to protect our older parents. We had to unfortunately let our nanny go, and I was very sad about that, but we didn't want to expose her to, our household with two physicians.
Wow.
And she's older. So many people have the additional stress also of losing income, unfortunately, those have small businesses. So there's no one size fits all type of coping. Everybody's the expert on oneself or themselves, but taking care of basic needs is non-negotiable, and it's more important than ever to maintain good health. Some elements of self-care might no longer be available, such as, going to a restaurant, if you like to do that with colleagues such as myself. And now I can't do that anymore. So what about it was helping? So I think it's important to find out that, what we let go of, there might be something else we can reproduce in a different form. What form can it take in your personal environment? Letting go of expectations is key. And because there's so much beyond our control right now, and trying to resist this fact might in fact create more suffering.
Right.
So stress management should include mindfulness or meditative practice, for instance, yoga. We also have to resist the pressure of being productive. I hear all these in social media or in the, I get all kinds of newsletters. You should do this, do that, do this. It's overwhelming. It's like, wow, it makes people feel inadequate sometimes. They don't want to get out of bed. They're trying to cope with the grief. Okay, that's okay. Today's not going to be perfect. If you get out, if you try to show up in life, do your best. That's enough, So it is normal to feel a transient lack of motivation and a paralyzing panic. And our minds can also be in overdrive at first as we try to adjust to a new baseline and problem solve. So we can't be very effective if we have our mind just spinning wheels like that. One advice I would say is find your anchors. For instance, your breath. The breath is always there, so it can kind of ground you. Or something you do to consistently relax, whether it's drinking a cup of tea, go on a morning walk, something to do with mindfulness, with full attention, without judgment. That's a form of meditative practice, but it doesn't have to be sitting. It could be doing what you do, but being fully present to that. Having a daily gratitude practice is another form of mindfulness. It's been described the benefits have been described in the literature, and they're numerous, including decreasing feelings of anxiety and depression, improving sleep, improving self-care, improving social connections. Keeping a gratitude journal or sending a thank you note daily can make you feel better. And also emphasizing the positive helps us counteract the negative bias, which is a natural tendency of our brain. Because our brain is like Velcro for negative experiences, but Teflon for positive ones. It was essential for our survival when we were hunters-gatherers many millions of years ago, but it's no longer useful, but we still have those remnants in us. So reprogramming your brain by installing positive moments and events that bring you joy It's not about denying the negative reality, but it will help you build your resilience. I developed, for instance, the habit of starting my meetings and group therapies and even family breakfasts by asking, name one thing for which you're thankful today, even if it's just the food or breathing or your health or, your family. Another strategy is to notice any pleasant experience for a few additional seconds so that it sticks in your memory and starts creating a positive loop. So in summary, for the mindfulness or meditation, if you do meditation in a form of cultivating joy, deep breathing, gratitude practice, it can help activate the parasympathetic nervous system, which is restorative, as opposed to the sympathetic one or fight or flight mode that is essential for survival. But when it's overly and chronically activated, it can be deleterious for your health and create complications. So from a neuroplasticity standpoint, mindfulness practices can reshape certain brain structures and increase gray matter in brain regions that can handle attention, empathy, compassion. It also improves immune function and well-being.
My experience has been very similar to that, in terms of I've had negative days and days where I felt fine, but then when other members of my household have been in a negative loop, so I've had to really try to be sort of appreciative of my lovely home and still being able to go outside. I've got a dog, so I can go to the park and so on and so forth. So I'm very fortunate compared to a lot of people, and that actually leads me on to my next question, which is, which sections of the population do you think are going to be the ones who are the most vulnerable? Which sort of demographics or ages are we sort of looking at?
Yes, and we are seeing some populations or subgroups that are being hit harder by this pandemic, unfortunately. So we're talking about older populations who are in nursing homes. For instance, in my hometown, the rate of infection of one of the nursing homes has reached 74%. People have started dying, and they have these makeshift morgues outside, and it's really, really horrific. It's a dystopian view, immunocompromised people of all ages, also socioeconomically disadvantaged nations all around the world who don't have access to clean water, for instance. I'm thinking also about the native populations, in Canada, in US, Australia, New Zealand, who might live in crowded and multi-generational households. People who have a severe mental illness, who are stigmatized and have barriers to care, who end up decompensating because they didn't receive treatment because of the barriers and stigma, and then with the consequence of being hospitalized in inpatient facilities, which, where a virus can spread like wildfire. The homeless populations, again, are internally displaced people, just like social economic disadvantaged nations. They don't have shelter, they don't have access to water necessarily. They might live in close proximity with other people. They might be chronically ill as well. You were talking about earlier the rate of divorce, what's going to happen. We see that victims actually of domestic and child abuse are, suffer more from the confinement, unfortunately. Escalation of domestic or household violence increases during war, natural disasters, and it has during this pandemic. I've received a bunch of emails and communications from colleagues telling me that really, really concerning and frightening reality. So these people are vulnerable because they no longer have access to the buffering support systems such as schools, churches, or a workplace where they could go and escape a difficult situation.
Wow.
There are also women seeking abortion care in the US. Their well-being is really compromised because that's considered non-essential care, but pregnancy needs to be terminated cannot wait, and a woman who doesn't have the means to continue that is really stuck there in this kind of political conflict and It's too bad that they become hostages due to this big controversy here, unfortunately. And then I'm thinking, of course, about people who are incarcerated because of overcrowded, conditions in the U.S., especially, and in other countries of the world. And people from African American descent who disproportionately work lower paying jobs or in areas where they need to show up for their work, sometimes commuting in crowded buses. And their legacy of trauma and oppression actually has contributed to a wide range of chronic medical conditions that is increasing their vulnerability to contract the virus and die from it. And we've seen that they're disproportionately affected, unfortunately.
Obviously, in the West, and I'm very, very privileged. I have the internet compared to sort of people in townships, let's say. So I'm able to continue working. So I don't have too much to complain about. But I've definitely found that through changing my lifestyle, making it all online, and my sort of social activities, and doing sort of quizzes and date nights and things on Zoom, get a bit of sort of screen fatigue. And I suppose now you have probably moved to also telehealth and doing video visits and video meetings. Have you sort of experienced the same sort of fatigue with using Zoom all the time? And is there any way to sort of get over that sort of tech inhibitor?
Yes, I can identify with that totally. I mean, it is a great advantage that we have a great backup, approach to deliver care and to maintain contact with some populations that, cannot come to our clinics or must stay home. But I noticed and heard of screen fatigue in the form of like even mental exhaustion,
right,
eye strain, insomnia, or even aversion to the screen, so it might be experienced after spending too much time in front of electronic devices of any kind. I would say that some tips to avoid that I've found that work for myself was, for instance, including podcasts and like this one, maybe listening to it instead of scrolling down as we read an article. Use audio resources as much as possible. Keep the meetings to a minimum and join by audio only when you can. It's nice to see people's faces, but I noticed that it's when we have Zoom meetings with a lot of people, then everybody's there in their own environment now, and then you have to process that. It's not like we're all sitting around the same table and you don't have to pay attention to the environment, but you have to pay attention to the people. But now it's like people in their environment. So for me, it's been like a little bit distracting.
Right.
And then also practicing mindfulness can help us kind of refocus our attention and shift gears and transition from one activity to another. And it's important to also have breaks or frequent screen-free periods that are spent doing something outdoors, to help with the digital detox.
And obviously, mental health has been on the kind of public health agenda for a while, but I'm wondering, what is collective care, and why is it important?
Mm-hmm. It's a concept that I became really interested in recently because we used it and I heard the name and I thought, this is wonderful. So it's basically self-care practiced in the presence of others or within interconnectedness, for the purpose of collective healing. Okay. So for instance, with the staff from other trauma recovery centers in the nation, we do have a monthly call. We talk about how we help our survivors of crime, but then with this new pandemic, we have additional stressors for our populations, also for ourselves. And then so we decided to start meeting weekly now for an hour to check in, to share success stories, express gratitude, read inspirational quotes, and practice meditation as a group. These are integrated in my approach to groups generally, whether it's a peer support group for a specialty in our institution working in the front lines and likely to suffer from direct trauma during this healthcare crisis, or the trauma survivors psychoeducational group that I'm leading at our clinic. The participants from that latter group have voiced many times how meaningful the bonding with other people has been for them. and they actually look forward to the session every week, even if it's via Zoom now. I hope this can also lead to collective healing as we all struggle together with this. And this will be essential after the crisis calms down, when the reality will hit us and all the losses. So we should practice being together as much as we can. And for now, it happens virtually, but meditation can be more powerful when done in the presence of others. And a healing circle can be helpful. There are so many people who lost loved ones, and many of them couldn't say goodbye in person, or couldn't mourn.
Yeah.
So people will continue to die from other causes as well during this pandemic. So we have to prepare ourselves to the idea of being emotionally vulnerable together. And it might seem paradoxical, but owning vulnerability is a sign of strength. It allows to coexist within suffering and helps with finding inspiration as we co-heal, accessing a form of vicarious resilience.
That's really nice. Yeah, I definitely believe in the power of sort of people coming together and saying, that this is what I'm having to deal with, and then it suddenly becomes okay socially to have issues and to talk about it when there's so much shame that's involved in some of the emotions that we feel, which makes it hard to process them in the first place. So yeah, something I will definitely look out for, more of those collective groups when I have things that come up. But this might come across as maybe a sort of religious or spiritual question, but it's not. You don't have to interpret it in that way. But how can people find meaning to this experience of such enormity? It's probably one of the biggest pandemics that the world humanity has experienced.
Yes, and I'm kind of an existentialist, so that's why I'm interested in that kind of questions. And it applies to anyone. I think finding meaning is a universal need. We all need to find meaning or to make sense of our experiences. So regardless of any belief system, I think it is applicable. So to me, finding meaning to the incomprehensible can help us cope with loss and grief. It's about finding the good within the suffering, or being able to experience post-traumatic growth. When something really catastrophic happened, how can we still grow after that? The 4 pillars of meaning are what I like to call the 4 overlapping S's. So they include sense of belonging, sense of purpose, storytelling, and spirituality. Again, it doesn't have to be religion. I mean, it's a distinct concept, but if you're religious, it could be your spirituality. But if you're not, you can still access it, right? You can still access spirituality. So whatever you can do every day to meet those 4 pillars will help. For instance, for me, co-facilitating a collective care group or participating in this podcast with you, Francesca, allows me to have a sense of belonging to the world. It gives me a sense of purpose as I prepare this dialogue with you, and I hope it might help. And also it might validate some people's difficult experiences. And I also tell a little bit of myself, right? And all of this is a way for me to transcend the adversity and access core values such as hope and compassion. Developing a philosophical perspective and seeking to cultivate joy constitute good soil for my spirituality.
That's wonderful. And I just have one final question for you, which is, what can we learn as a society from this and as citizens of the world?
Yes, I'm also wondering about that frequently. I think the planet is sending us a wake-up call. The way we've been living our lives is no longer sustainable. It's destructing our really fragile ecosystems.
Right.
It's quite self-centric or egotistic at times, and the way it is affecting our world right now, airborne pathogen and the air we all breathe, kind of demonstrates our interconnectedness too.
Yeah.
So this problem transcends the notion of nationality, borders, race, etc. I think national leaders must work together and develop a unified approach, leaving their personal interests or ego battles aside, and think about the greater good.
Yeah.
Even when there's polarization of people with different political views, and we have that here, it's possible to connect through our shared humanness. At least we must try. Traditional hierarchies in our healthcare systems and other institutions should be abolished.
Wow.
We all can extend a hand to those in need, regardless of gender, race, age, religion, or socioeconomic status. There is no us, them. Everyone has something valuable to share, and everyone can contribute and humbly receive help. Someone once wrote, everyone does better when everyone does better. I deeply believe this. And Boris Cyrulnik, who's a psychiatrist and also an expert in resilience, said that after this, a culture shift will happen. I hope we can all be part of a revolution of compassion and contribute to collective healing.